afternoon. Thank you. Your Excellency, you're most welcome. And then we will now kindly ask for your permission to kindly rise for the national anthem. Police band, can you lead us in the national anthem? Thank you. You may kindly get seated. And thank you, policeman. I now invite Imam Radwo Banjul, Imam Chorno Ka to come and lead us into Muslim prayer. Imam, welcome.
السلام عليكم ورحمة الله. أعوذ بالله من الشيطان الرجيم. الحمد لله قال في محكم التنزيل وننزل من القرآن ما فيه شفاء ورحمة للمؤمنين. وأوحى ربك إلى النحل أن اتخذي من الجبال بيوتا ومن الشجر بيوتا فاسلكي من سبل ربك ثم كلي من كل الثمرات فاسلكي سبل ربك يخرج من بطونها شراب مختلف ألوانه فيه شفاء للناس. محمد صلى الله عليه وسلم قائل إن لا ما من داء إلا وله دواء إذا مرضتم فتداووا ولكل داء دواء إلا الداءين الموت والألم. الحمد لله balaa ñoo ñaan nuyu ñëpp sant ñëpp His Excellency Président ak mboolem nguur gi ku nekk sa position ak sa ak woñ bokk ñi dëkkee réew mi ñëpp lii ñu woote lu am solo la. buñ déglu waxkat yi nga xam ne dañuy yàq xeli nit ñi yàlla su boppam wax si alquran ne lu ne amal na ko garab sóoratu Nahl dégg nga jàng ko léegi mu wax garab gi nekk ci lem ne lépp amoon nañ njàmbataan am kuréel am jardaaral am li nga xam ne moo doon li ñuy wax ràmm ak ngas ak waga ak yeneen feebar yu bari ngaana gumba yi la yëpp taxaw nañ gëstu ba gis garab gi faj ko at yu yàgg a yàgg Seydi Hadji Malick bu pikiroo nga xam ne kon pikir yàgg na fi su ko defee kon nag lii buñ ci yàq dari nit ñi xelli nit ñi bañ a pikiru ku ko ci deful itam defuloo yoon faju dañ koy def loolu lañ doon leeralal nit ñi ñu xam ne lii ku ko deful itam defoo yoon na ñëpp fexe péngu buñ déglu yàqkat yi nga xam dañuy wax naan péngu bi nii péngu bi ne ba bañ a féngu kon ku ko ci def itam boo loroo yàlla sa bopp boo loree keneen koo dendeel yaa ko lor yàlla musal ci loolu auzu billahi mina shaytaani rajim bismillahi rahmani rahim alhamdulillahi rabbil alamin الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين ربنا تقبل منا إنك السميع العليم وتب علينا يا مولانا إنك التواب الرحيم ربنا هب لنا من أزواجنا وذرياتنا قرة أعين واجعلنا للمتقين إماما اللهم اجعل بلادنا غامبيا بلدا آمنا مطمئنا يا تارس قارقدا من كل مكان ونجينا من كل بلاء وقلا وتعن وسنا ووباء طير من ذنب ذلك بلادنا خاصة بلاد المسلمين عامة بحرمة اللهم صل على سيدنا محمد الفاتح لما أغلق والقاتم لما سبق الناصر الحق بالحق والهادي إلى صراطك المستقيم وعلى آله حق قدره ومقداره العظيم إن الله وملائكته يصلون على النبي يا أيها الذين آمنوا صلوا وسلموا تسليما سبحان ربك رب العزة عما يصفون أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين بحرمة اللهم صل على سيدنا محمد الفاتح لما أغلق والقاتم لما سبق الناصر الحق بالحق والهادي إلى صراطك المستقيم وعلى آله حق قدره ومقداره العظيم سبحان ربك رب العزة عما يصفون وسلام على المرسلين لله رب العالمين بحرمة لا إله إلا الله لا إله إلا الله لا إله إلا الله محمد رسول الله صلى الله عليه وسلم آمين توفيق غيرك mucc ak barke
Imam, thank you. Jerejef. May Allah accept your prayers and all the prayers. I now invite Bishop Idoko to lead us in the Christian prayer. Bishop, welcome.
In God's name, Father, Son, and Holy Spirit, amen. Gracious and eternal Father, most holy God, Father of all mercies, the Creator, the Sustainer, and the Protector of all humankind throughout the whole universe. We in this nation, the Gambia, call upon your most holy name this day on the launch of the national launch of COVID-19 vaccination program in this land. We thank you for the government of the day. We also thank you for all our development partners that are working hand in hand with the government. We thank you also and present before you the front-line workers, the health caregivers, the doctors, the nurses, the pharmacists, the health administration, the cooks, the orderlies, the cleaners, the drivers, and all the security and all Red Cross volunteers throughout the length and breadth of this nation. We commit them under your direction. We pray that by your almighty power, you shall grant them the grace to be, as they execute this sacred task of caring for the sick, grant them the patience, grant them the love, and grant them the dedication, and also grant them the wherewithal to execute this duty in the most effective and efficient manner. We continue to pray that you bless this program, bless the vaccination that will be used nationwide. We pray that it will be effective in eradicating from this nation this COVID-19 and its cohort, the new variants. You, the healer of all, we pray that by your almighty power and by your healing, miraculous, wonder-working power, that you shall grant the most effective, efficacious healing in this vaccine, so that all will be healed and everything will return to normalcy. Grant us in this nation and in all other nations of the world, grant all of us clean bill of health. This we ask through Jesus Christ our Lord. Amen.
Amen. May Allah accept our prayers, and thank you for the time. His Excellency, the President of the Republic of the Gambia, Mr. Barrow, Her Excellency, the Vice President, Madame Dr. Aisha Toure, the Honorable Minister of Health, Dr. Hamid Lamin Samate, and Cabinet Ministers here present, Secretary General, Secretary of Cabinet, religious leaders, the Diplomatic and Consular Corps, directors here present, program managers, advisors to the President, the media, and anyone who is able to find time out of their busy schedule to attend this important occasion. I say good afternoon to all of you. And today we are here to witness the launch, or the national launch, of the COVID vaccination campaign, which is going to be launched by His Excellency the President, to at least to give us the courage to take this vaccine, and as well as to raise awareness among the general public. I also want to recognize the World Bank, the WHO, UNICEF, all other UN agencies that are present here. I also want to recognize your presence and thank you for coming. I don't want to waste much of your time. Time is not really on our side, and I will go straight to the program. And here I now invite the representative of WHO, that's the WHO country representative, Dr. Desta Tiruni, to come and give a statement. WHO rep, you are kindly welcome to come and give your statement.
Good afternoon, everybody. Thank you, Program Director. Your Excellency, Mr. Adama Barrow, the President of the Republic of the Gambia, Your Excellency, the Vice President of the Republic of the Gambia, Dr. Satu Toure, Honorable Dr. Ahmad Lamin Samate, Honorable Minister of Health, Honorable members of the National Assembly, Honorable members of the Cabinet of Ministers, Your Excellencies, Ambassadors and Higher Commissioners from European Union, the United Kingdom, United States of America, Germany, France, Spain, and Qatar, who are present here with us. UN Resident Coordinator, Ms. Sarafin Wakana, my colleagues, resident representatives of the UN agencies, high government officials, National COVID-19 Response Coordinator, media representatives, ladies and gentlemen, all protocols duly and respectfully observed. I'm really honored and delighted to be part of this important landmark event following the arrival of the COVAX vaccines, which is a dream come true for the Gambia and for the whole world in the fight against COVID-19. As you all know, the number of COVID-19 cases is still high around the world, It's declining in some countries and increasing in the others. In Africa, we are observing a downward trend in the new cases with 56% decline between January and February. However, this trend is driven by some of the most affected countries like South Africa, which are contributing to the huge part of the COVID-19 cases. So it's not uniform. Even in Africa, in some countries, it's increasing, in others, it's declining. 11 countries have reported an increase in the number of cases of COVID-19. As of 6 March, the African continent has reported more than 3.9 million COVID-19 cases and 105,482 deaths. 10 countries are accounting for 75% of the cases in the African continent. In the past 28 days, South Africa leads with more than 46,000 new cases in February, followed by Ethiopia with 23,000 cases. Zambia, Nigeria, Mozambique, Ghana, Botswana, Senegal, Kenya, and Malawi account for 21% of these cases. Similarly, the Gambia has also experienced the second wave of the pandemic in Africa with an upsurge in the number of cases and deaths. Therefore, we can understand COVID-19 is with us and will remain with us for quite some time to come. So we are not over it. The arrival of vaccines through the COVAX facility in the Gambia and Africa is a significant triumph in the history of public health and should be celebrated. COVAX facility is one of the 3 pillars of the access to COVID-19 tools, which is known as ACT Accelerator, established to accelerate the global development, production, and equitable access of COVID-19 tests, treatments, and vaccines. COVAX is co-led by Gavi, the Vaccine Alliance, the World Health Organization, the Coalition for Epidemic Preparedness Innovation, working in partnership with UNICEF, as well as the World Bank, civil society organizations, manufacturers, and many others. COVAX aims to achieve 4 objectives, actually 5 objectives. One is to make sure at least we have enough vaccines for 20% of all countries participating under this umbrella. The other important objective is also to be able to access diverse group of vaccines which are actively managed. So we'll be able to access several types of vaccines that are effective as they come into the market. The third one is also delivering vaccines as soon as they are available because of the guarantee, the advanced market commitment, which is granted through the COVAX arrangement, will also guarantee quick market for the producers. So this is also makes it faster to reach out to access these vaccines. Ending the acute phase of the pandemic is also the ultimate objective, to stop the pandemic. And if we stop the pandemic, we'll be able to achieve, we can rebuild the economies. This is the objective of the COVAX arrangement. It's a novel objective and a novel partnership. Your Excellency, this is the first time that countries have come together to fight the global pandemic, global threat, with unprecedented solidarity. Without COVAX, many low and middle income countries such as the Gambia would have been completely left out and wouldn't have been able to witness what we are seeing today. The COVAX facility has so far delivered more than 11.6 million vaccine doses to 17 African countries, and more are yet to come. Here is what the World Health Organization Director General, Dr. Tedros Adhanom Ghebreyesus, said when he witnessed the first arrival of vaccine in Ghana. That was the first arrival. This is what he said. This is a day many of us have been dreaming of and working for more than 12 months. It's gratifying to see the fruits of that labor. But success is still to come. This is only the beginning of what COVAX is set to achieve. We have a lot to do to realize the vision to start vaccination in all countries in the first 100 days of the year. By that time, I think it was end of February, there are still 14 days to go. So within 14 days to start in all countries. This is what we want to achieve. And if we do that, we are successful and we'll be very delighted. Therefore, on behalf of the WHO and the COVAX partnership, I would like to express our sincere gratitude to all donors for putting their money and trust in the COVAX facility and making this dream come true. Please allow me to extend my appreciation and highest regard to the donors that are represented today here at this occasion for the generous support and donations. These are the European Union, which includes the European Commission and the Team Europe, the United Kingdom, the United States of America, Federal Republic of Germany, France, Spain, and Qatar. Thank you so much for your support. The arrival of the vaccine gives us a great hope to contain the effect of COVID-19 in 3 ways. One is to protect the most vulnerable group of the population from getting COVID-19 and save lives. The second is, if we do that, we will preserve the provision of essential services by reducing the number of severe cases that will be admitted and that need care and that will be exhausting the resources of the health services. This is the second. And if we can achieve this, we can stimulate also the economies, the economic activities, and speed up recovery. Your Excellencies, the fastest and most efficient way to do that is to ensure we protect our health workers and we protect our older populations and people with comorbidities, with pre-existing conditions. That's going to be the fastest way to get us out of this pandemic. However, I want to emphasize that countries cannot solely rely on vaccines. The vaccines alone are not sufficient to contain the transmission of COVID-19. As you have witnessed, many countries before the arrival of the vaccine were able to contain the spread of the disease. And we have very good examples around the world. So we have to use the time-tested basic public health measures, and this remain the foundation of containing the spread of the disease. That's to say, mask wearing, like what we do, physical distancing, the way we are sitting, keeping distance, we have to maintain this, and hand hygiene. This, we have to maintain all of them at the same time. It's not one or the other. All of them, 3 of them, are all the time, everywhere we are. That's what's going to actually help us to stop the pandemic. WHO's focus now is at keeping the transmission low, prevent the emergence of new variants. We have heard about the emergence of new variants that are not responding to vaccines. So vaccines by itself is not a solution. If we don't stop transmission, the new variants can spread, and we may go back again to square one. So it's very important we contain the spread through the public health measures. Mask, distancing, hand hygiene. I repeat it, very important. It will take us out of this mess. While celebrating the COVAX victory in ensuring access to many countries around the world, we should not forget to pay due respect and heartfelt appreciation to the government of the Republic of the Gambia, particularly His Excellency, the President of the Republic of the Gambia, Mr. Adama Barrow, Her Excellency, the Vice President of the Republic, Dr. Aissatou Touré, the Vice President of the Republic, and Ministerial Subcommittee, Honorable Hamadou Samate, for their leadership and commitment through these difficult days during the COVID-19 pandemic. We are also greatly indebted to health workers who have always been and still are in the forefront of the fight against COVID-19. Your dedication and commitment is highly appreciated. Thank you so much. But health workers were not alone. There were many other frontline workers who kept us through the difficult times, who supported and facilitated the work of these health workers, both in the public and private sector, like the armed forces, the police, those who are running the shops, those who are running different businesses, who were able to supply the commodities, the essential supplies that we require for existence. So we really appreciate all of you for all your efforts and solidarity in this difficult time. In WHO, we are very grateful to all partners who forged strong partnership with the government of the Republic of the Gambia in its fight against COVID-19 since February 2020, before even the case was reported here. Partners gathered together, trying to support the government to get out of this problem together. And this includes the United Nations system. In the United system, particularly, I would like to express my sincere appreciation to Ms. Serafin Wakana, who is the resident coordinator, who led the UN team so brilliantly to make sure that the support is well coordinated. And among the UN agencies, I cannot name all of them, but I can mention like UNICEF, World Food Program, UNFPA, UNDP, UNOPS, IOM, FAO, and many others who came together and worked day in, day out, and supporting the government effort to make sure that we succeed in the fight against COVID-19. The private sector, the Gambian Red Cross Society, institutions and private citizens who supported the COVID-19 response technically, financially, and in kind. All of you, thank you very much for your solidarity. With that, I think I would like to end by quoting my Director General, who said this: "We will not end the pandemic anywhere unless we end it everywhere." I thank you very much for your attention.
Thank you very much, Dr. Desta Turudi, the WHO country representative, for sending out a clear message with regards to reminding people with regards to the messages that we have been talking about. In addition to the vaccine, I am sure when those messages have been practiced, we can be able to cut down the transmission of COVID-19 in this country. Your Excellency, I also want to recognize the presence of the CMD EFSTH. He's here with his team. I want to recognize Dr. Sam of World Bank. The able organizing committee of this event, I want to recognize your presence. EPI and the health promotion team, well done and thank you for the excellent coordination of this event. The UNDP, UN Resident Rep, the Secretary General Gambia Red Cross Society, and as also the National Coordinator for COVID, I want to recognize your presence. And on that note, I want to now invite the UNICEF Country Representative, Jonathan Lewis, to give a statement. Thank you, Jonathan. Welcome.
Thank you very much. Good afternoon. Thank you, Master of Ceremonies, Your Excellency, President of the Republic of the Gambia, Adama Barrow, Madam Vice President, Isatou Toure, good to see you at this event. Honorable Minister of Health, Dr. Amadou Samate, other members of the Cabinet of the Gambia, as well as members of the National Assembly. I'd like to very much recognize and appreciate the presence of our religious leaders, the Imam as well as the Bishop. Acknowledge the presence of all members of the diplomatic community, with a particular note, of course, on our 7 COVAX donors based in the Gambia. I would like to recognize Madam UN Resident Coordinator and all of the heads of UN agencies, funds, and programs. Frontline health workers who are present here today. I'd like to acknowledge the beautiful musical renditions of the band that graced us during the morning. Also acknowledge the presence of the media. It is through you, the media, that the most important messages to combat and to fight the disinformation and the false information which is out there so relevant, so thank you for being here. Ladies and gentlemen, to one and all, our good afternoon to you. Mr. President, thank you so much for extending the gracious hospitality of the State House for this important event. And I'd like to maybe recall the fact that on Monday we celebrated International Women's Day. And when we kick off with International Women's Day and March being International Women's Month, let us not forget that the real impact of COVID in many countries is the face of a girl child, is the face of an adolescent mother, is the face of a woman who's having difficulties to put food on her table. And we have seen that here in the Gambia. I'd like to perhaps try to put a little bit of context to the fact that let's not forget that we started in March 1 year ago with COVID-19, not only here in the Gambia, but throughout the rest of the world. And the socio-economic impacts are real and they are evident. Here in the Gambia, to this date, the information that we have from the Ministry of Health is that approximately a little bit more than 4,800 cases of COVID have already been registered. We have more than 150 deaths that have been registered as well. So this is very real, as Dr. Desta points out. This is happening as we speak. And also, let us not forget that at one point last year, approximately 700,000 children and adolescents were impacted by the protracted and the prolonged closure of schools. And only 46% and 36% of urban and rural households, respectively, at one point during that period, had only one active student learner either benefiting from different moments when schools reopened, for example, for the grades 9 and 12 examinations, or through remote learning mechanisms. Not only that, we are aware that the Gambia is a country which is highly debt distressed the impact on the macroeconomy has had a profound negative effect on the debt to GDP ratio, and this is important that we acknowledge. A recent rapid survey by the World Bank, which is called a high-frequency survey, which is also conducted in collaboration, Your Excellency, with your Gambia Bureau of Statistics, revealed that 50% of households during the peak of the impact reported not being able to stock up on food as usual, and that 9 out of 10 households suffered a decrease in income. There was a need to support families through different ministries, such as the Ministry of Health, the National Nutrition Agency, the Ministry of Gender, Women and Gender, Children and Social Welfare, to support through the provision of cash transfers, food transfers, an ever-increasing number of children in poor households who were being affected by increases in severe acute malnutrition. And at one point, the EPI program reported to us that because of flight cancellations, we had a temporary stockout that lasted 3 months of vaccines for the expanded program immunization, but most importantly, vaccines for oral polio. So this is to say that, as we all know, it is here and we have to deal with the impacts. But against the face of the impacts, we also need to put out the information regarding practice. A recent U-Report survey, which was conducted by UNICEF in December 2020, amongst a total of 3,000 respondents, revealed some really very interesting issues that I think we should take into account. 78%, that is, 8 out of 10 individuals who responded, indicated that COVID-19 preventive measures in their area of residence are not being respected. 8 out of 10. That's what they see, that's what they're reporting. 44% of them believe that COVID-19 preventive measures are not being respected because they believe that COVID-19 is already over in the country. And finally, 88%, that's 9 out of 10 individuals, have facial masks, and sometimes more than one. However, only 45% use masks on a regular basis, which is sharply down from the 80% of regular users in the same survey that we had conducted 5 months before. So regular mask usage has gone down from approximately 80% to 45%. And I cannot underscore enough the messages that Dr. Tirune has shared with us vis-a-vis the fact that the vaccination against COVID is only one of several strategic tools in the national toolbox against COVID. To talk a little bit more about the syringes and the vaccines under the COVAX facility, let me say that at the end of this week, we're hoping that almost the entire continent is going to be covered by COVID vaccines. Already approximately 13 to 50 million doses have already been distributed. And note this, in the short span of 10 days, we were able, through the COVAX facility, to get a significant amount of number of vaccines to different countries, many of which are on the African continent. And by the end of the week of, by 10 March, that is today, we're hoping that an additional 17 countries will be receiving COVAX vaccines as well as syringes to be able to launch their campaigns. We are looking at the possibility of increasing the already secured 1.2 billion doses of vaccines that COVAX has been able to negotiate with the different vaccine manufacturers that obviously have gone through the most stringent regulatory and testing procedures led by the World Health Organization and national regulatory authorities. We hope to be able to increase the allocation to 2 billion doses by the end of 2021. You've all seen it in the news in the case of the Gambia. We were fortunate that we were among the first 5 countries on the African continent, starting last Sunday on the 20th of February, to receive the initial batch of 37,500 syringes. We will soon be receiving almost 930,000 syringes, which together with a very generous contribution of 40,000 syringes by the Medical Research Council, Your Excellencies and Minister, you should be well on your way to be able, at least with the syringes and the doses that we have, to kick off the campaign. The Gambia will receive a total of 156,000 doses before the end of May. You all know that last Tuesday we received the first consignment of 36,000 doses, and the additional consignments to sum up to the 156 should be received before the month of April. So, as you can tell, this excellent effort at global solidarity and multilateralism is moving extremely quickly, and we are all very happy for that. But vaccines are not free. They cost a lot of money. And during the height of putting forward the COVAX facility, if it had not been for the extremely generous contribution of numerous countries, high wealth individuals, foundations and companies, we would not have been able to reach a historically low value of these vaccines at approximately $2.5 to $3 per single dose, which is an incredibly, it's an incredible feat to be able to reduce it to that amount. But the countries that provided to COVAX were also undergoing their own fiscal consolidation difficulties as well as their own challenges against COVAX. And we have already mentioned here the fact that present in the Gambia, we have 7 donors, and I wish to repeat them because of the fact that had it not been for them, and I'll mention one statistic which I think is really very relevant, that of the almost $4.4 billion that have been able to be mobilized from all donors for COVID, these 7 donors and their headquarters were able to mobilize approximately 69% of the total contributions to COVID. That means that $7 out of $10 of each $10 for this contribution came from these extremely generous contributions. So we wish to thank you, Mr. Ambassador of the European delegation to the Gambia, the 3 members of Team Europe, Germany, France, and Spain, the Embassy of the United States of America, the British High Commission, and obviously the Embassy of Qatar. And really, without you, literally, it would not have been possible. So we're hoping that as we move forward, we're going to be able to spread the world with the generosity and the protective value of these vaccines. As you all know, we're working hand by hand, WHO, the World Bank, UNICEF, but not just those 3 agencies. I think we also need to recognize as well your very own Gambia Red Cross Society that has been accompanying all of the discussions, all of the technical conferences that we've been having as well, and these are very important contributions indeed. So, Your Excellencies, the Minister of Health, I really do want to acknowledge the excellent work of everybody involved in the response. It's been literally 24/7, and when we say 24/7, it really has been 24/7. We believe that with this, we're finally going to be able to reach that vision, which is that finally there is light at the end of the tunnel. So thank you very much, congratulations, and Godspeed.
Thank you, Jonathan, for that excellent statement. I will still continue to recognize the presence of the health workers that are all present here. And Your Excellency, I wish to inform you that vaccination of health workers have already started. And most of the health workers have also taken their vaccine. And then we also want to thank them and recognize their efforts in participating in the vaccination program. I also want to recognize the presence of the Senegalese ambassador. We know they've also supported us. And I also want to recognize the ambassador to be delivered by Covas Bit, your statement.
Your Excellency, Adama Barrow, Your Excellency, Madam Vice President, Dr. Toure, Honourable Minister of Health, Honourable Members of the Cabinet, national partners, and especially the health workers here today, the frontline health workers, please allow me to observe all other protocols. I speak to you today as co-chair of the Development Partners Group in the Gambia, Spain, Qatar, the United Kingdom, the United States of America, and the European Union. Over the past year, all across the world, we have felt the impact of the COVID-19 pandemic, devastating the health of people and countries and our interconnected economies. International partners, including Commonwealth, the United Nations, the World Health Organization, UNICEF and many others, are delivering a strong global response. The Gavi COVAX pooling of resources to provide 1.3 billion COVID-19 vaccine doses for up to 92 eligible countries in 2021. Vaccines are the way out of this acute phase, enable health workers to get back to work and deliver other health services that have been disrupted, and help begin the process of economic recovery from the impact of this crisis. But as we've already heard, and it does bear repeating, we must remember that vaccines alone at this stage are not sufficient. It remains crucial that we all follow Ministry of Health, WHO guidance on mask wearing, hand sanitisation and physical distancing, as we are still quite a ways from defeating the scourge of COVID-19. Together, caring for each other, how we as a global community will emerge from this challenge stronger and more resilient. We are pandemic. Being unified in our vision and efforts, we can all get to the other side of this terrible pandemic and build back better and stronger, whether it is our economies, livelihoods, or future prospects. This today is a historic step towards our goal to ensure global distribution of COVID-19 vaccines in what will be one of the largest vaccine procurement and supply operations in history. The delivery is part of a first wave of arrivals that will continue in the coming days and weeks. So to end, I just say we are not in this alone. Together, we can overcome this pandemic.
Your Excellency the Ambassador, I now move on to the fourth item on the agenda, but before I call him, Your Excellency, I want to kindly give a brief overview of what has happened so far with regards to the COVID response and as well as the vaccination campaign. Prior to this particular day, the Honorable Minister of Health and team have been working very hard. And looking at the plan also, it has various components. Key among them is capacity building for health workers. That have been done in the regions, various regions, health workers have been trained. And there have also been micro-planning. Micro-plans have been developed by the regional health directorates in all the regions. And then currently we're implementing what we have planned. So we also have a surveillance meeting that an update in the various thematic areas. On the thematic area, for example, case management, you have risk communication and community engagement, your psychosocial support and research, surveillance, and then build the laboratory, and as well as also point of entry. We meet, brainstorm, and we put up ideas. Reviews are possible through the technical guidance and support from the Honourable Minister. I now invite the Honourable Minister of Health, Honourable Ahmed Lamin Samaria, to give a statement. Thank you.
Thank you very much, Mr. Chair. His Excellency, the President of the Republic of the Gambia, Mr. Adamo, the Secretary General and Head of the Civil Service, members of the Diplomatic and Consular Corps, the National Assembly members here present, and that of the IMF, the COVID-19 coordinator, senior government officials, religious and traditional leaders, the Secretary General of the Red Cross, our very hard-working staff of the Ministry of Health and other frontline health workers, civil society organizations, men and women of the media, distinguished ladies and gentlemen, we are gathered here today to mark the continuation of our efforts to prevent and control one of the most devastating diseases of our time. It is by now clear to all that the outbreak of COVID-19 in 2019 has brought unprecedented and a new wave of global public health challenge, which has stretched the health systems to their limits and disrupted all aspects of lives and livelihoods at a global scale never witnessed in the last century. Efforts to protect us, to deal with the health situation, and also to alleviate the suffering of the people. We have seen since the beginning of the outbreak that no government has all the means at her disposal to fight the pandemic alone. Instead, the whole world embarked on an unprecedented search for a quick means of curbing the spread and combating the disease. Accordingly, our ministry is preventive and curative in our health facilities. Through the leadership of His Excellency, the President of the Republic of the Gambia, the government provided the necessary direction and financial support in our collective efforts against COVID-19. This started with the setting up of the COVID-19 Ministerial Committee that interacted at various levels going. Numerous interventions, including declarations of state of emergency, closure of the airports, land and sea borders, were declared by the government to help us prevent and contain COVID-19. At this juncture, we thank His Excellency for his leadership in steering the affairs of COVID-19 response in this country, and the Vice President for chairing the COVID-19 Ministerial Committee, and all my colleagues for the long hours that we spent to ensure that decisions were made to guide the government's response. Global Alliance for Vaccine and Immunization, Gavi, World Health Organization, the Committee for Epidemic Preparedness Initiative, and their partners, the partner countries, made it possible to access these vaccines, which we are launching today. We remain hugely grateful to the facility for their commitment to help the low and middle income countries protect the lives of millions of people in these countries. The COVAX facility will provide vaccines for 20% of our population. This allocation will be able to vaccinate all persons aged 41 years and above, including the priority groups. This sums up to over 480,000 people. Doses, which will be able to cater for 18,000 individuals. This was expedited following the submission of the required documentation. Within a very short period, the COVAX vaccines were available for delivery to the country. This is indeed historic, and it is also a momentous occasion for every Gambian. At this juncture, we'll also want to thank our sister Republic of Senegal under the very good brotherly relations between our two heads of state, President Macky Sall and President Barrow. With a very good working relationship, Senegal has given 10,000 doses of COVID-19 to the Gambia. We thank you very much. Now that all the logistics are available, our plans to ensure that vaccination of health teachers, security forces is expected to kick off today. I must reiterate that the government of the Gambia only accepts vaccines that are safe and effective, and these vaccines have passed the test. The Gambia government, in collaboration with its traditional and development partners, had come together in an unprecedented fashion to support the government in its drive to combat the disease in the country. The entire machinery had been mobilized by the President, as I mentioned earlier, to respond to the COVID-19 pandemic and its ramifications. Your Excellency, COVID-19 had been a very difficult time in the history of this country and the world all over. It had been difficult. It has stretched our health systems, especially those of us who had weak health systems before the onset of the COVID-19. It has stretched our whole health system to the limits, but with the support of government and the partners, and with the hard work and dedication of the healthcare workers, the frontline workers, we are where we are today, and COVID-19 did not have a stronghold in this country. We thank the Almighty Allah for making this possible. Have mercy on their souls and grant them Al-Jannah. We will forever remember them all. They did not have the opportunity to be vaccinated. Probably if they were vaccinated, they would still have been here with us today. I think this is a big opportunity for some of us, for all of us who are alive today. Your Excellency, as we gather here today to launch the national COVID-19 vaccination exercise, using the first batch of consignment of COVID-19 vaccines, this will mark the beginning of the end of the pandemic globally, inshallah. It is therefore highly significant that all Gambians classified as high-risk groups be vaccinated. I want to take this opportunity to call on every Gambian and those resident in the Gambia, especially those regarded as high-risk groups, to get vaccinated to protect themselves, their families, and the entire population from this dangerous disease. We must close our ears to those few elements amongst us who are spreading false information about COVID-19 and the COVID-19 vaccines and dissuading people from being vaccinated. Because of the seriousness of the disease and its negative consequences, we did see at some point the Holy Haram in Mecca and Medina, as well as the Vatican, temporarily closed seriously. We want to use the opportunity to inform the population that believing in false information could cost people their precious lives and may end up causing people to lose their loved ones. We shouldn't allow the disease to get an upper ground in this country now that the opportunity is there to get vaccinated. Your Excellency, the population of this country is known to be highly receptive to vaccination. Since the establishment of the EPI in 1979, the Gambia has been found to be quite successful in the various vaccination campaigns that took place in this country, and this has led to the eradication of some of the diseases, especially the childhood killer diseases, and we anticipate such acceptance, and we work together to achieve that. Your Excellency, at this juncture, I know the day is far gone, but we want to inform the distinguished ladies and gentlemen here that the government of President Barrow has taken the healthcare system of this country to another level. There has been immense strategic leadership, immense commitment by government to the development of the healthcare sector by improving the health facilities. All the health facilities will be renovated in this country very soon, inshallah. We've had procurement of a lot of equipment, life-saving equipment. A whole lot of millions have been spent on the procurement of life-saving equipment in this country for the very first time in the history of this country that we bought those items. Ambulances have been procured and we continue to procure them. We are building capacity. We are training 200 extra nurses, state-enrolled nurses, and community health nurses to help us deal with COVID-19 and to help strengthen the healthcare system in our effort to reduce maternal mortality. And this we are able to do with the support of the UNDP. We thank them very much. And then the UNFPA is providing a lot of resources, many millions, to ensure that these people are trained. The UNFPA is also here. We thank them very much. Your Excellency, we also training 50 nurse anesthetists at the University of the Gambia in collaboration of Edward Francis Small Teaching Hospital to BSc level, and also 50 midwives to BSc level. All this is geared towards dealing with the healthcare challenges, and this the World Bank is supporting. We thank them very much. They are right here. The country has also started residency training for doctors in this country to health specialization. Edward Francis Small Teaching Hospital is carrying that out, and it has already started. And discussions are far advanced in getting specialist training for all the other healthcare workers, nurses, public health officers, so that we have targeted training to be able to cater for the needs of this country, including the pharmacists and all the other healthcare workers, laboratory scientists as well. So we are building capacity, because without the needed capacity, irrespective of what we put in place, what equipment we buy, what facilities we have, will not be able to deliver as the people of this country expect us to. And we thank you for your leadership and commitment. Thank you very much, Your Excellency. Your Excellency, I would like to close at this point, but once again, we want to thank your government for the leadership and for making this possible for the health sector to make these decisions, because these decisions certainly come from the highest level. We are unable to do much as a health sector if we do not get the direction and the commitment of the government from your own level to the level of the cabinet and to all our partners. We say thank you. Excellency, there are a lot of countries here, our partners, who have supported us. The Republic of China, People's Republic, the United States, the United Kingdom, the EU, Cuba, Senegal, UAE, India, and Qatar. We've been working very, very hard with their ambassadors. We've been having personal calls. They've been showing concern, and they do ask, where can we help you, Mr. Minister, so that we deal with COVID-19 and the after effect of COVID-19. And we want to use the opportunity to thank them all. They are all present here. And the final one, I must tell you, it had been very, very difficult. COVID-19, when people are afraid of death, when people are afraid of getting infected themselves, when we are all afraid of getting infected and our families also getting infected by us carrying the viruses home, all those fears were suppressed because we wanted to go out there and care for the people who are sick and in need of our services. And we said, come rain, come shine, whether we are at risk, of death or contracting disease or whatever, will go there to provide the services for the needed people of this country. That's what the healthcare workers did, and we thank them very much from the bottom of our hearts. All the volunteers, we say thank you very much, the Red Cross volunteers and other partners, civil society. A lot of people participated, and here we are today launching the vaccine, and we wish all of you the best. Thank you very much, Your Excellency. Thank you.
Thank you so much, Honorable Ahmed Lamin Samata. I will still continue to recognize the presence of the Supreme Islamic Council President, Al-Haji Esa Dabo, and all other ambassadors I mentioned earlier on EU, UK, US, France, Germany, China, and others. So I want to recognize your presence. About the person. This is the person who personally directed for the Minister of Health to be supported financially at the tune of over $500 million to fight COVID-19 in this country. The same person also directed the establishment of a cabinet subcommittee to guide, to provide guidance for the entire response. And also, the same person also has been supporting the Minister of Health in terms of provision of equipment and all other. And this person is no other person other than His Excellency, the President of the Republic of the Gambia, Mr. Adama Barrow. I now invite you to come and give your statement. Thank you. Your Excellency.
Fellow Gambians, friends and partners of the Gambia, we are here today to launch the Gambia's national vaccination campaign against the COVID-19 pandemic. A year ago, the country officially recorded the first case of COVID-19. At present, although most of those infected have recovered, unfortunately, over 150 deaths have been recorded countrywide. The pandemic has crossed all borders and boundaries of gender, age, status, and other characteristics. Like other sectors, not even the frontline defenders in health or with loss of loved ones, friends and citizens, both in the country and the diaspora. The pandemic has taken its toll on virtually everyone, emotionally, socially, economically, or otherwise. It is a relief, therefore, that suitable vaccines have been discovered, tested and approved by reliable experts. I am sure all of us wish that the vaccines were discovered earlier to save more lives. Thankfully, the Gambia has received 36,000 doses of AstraZeneca vaccine under the COVAX package. This is remarkable. We thank you, COVAX. Let me reassure you that the World Health Organization, WHO, has confirmed the safety and effectiveness of the vaccine for the prevention and control of COVID-19. On behalf of the government and the people of the Gambia, I express sincere gratitude to the Global Vaccine Alliance, UNICEF and WHO for this important development. Also, we have received 10,000 doses of the senior farmer vaccine from the government of Senegal. I thank my brother, His Excellency, President Macky Sall, for this kind gesture. Mr. Ambassador, we thank the President and the people of Senegal for the gesture and support. In another development, the World Bank has provided resources to procure up to 40% of the country's vaccine requirement. It will complement the 20% already secured through the COVAX arrangement. The first batch of this lot is available and will be rolled out today. This is a positive step towards realizing my government's urgent and passionate desire for full protection of every citizen against COVID-19. In launching the COVID-19 vaccination campaign today, priority will be given to those who are highly at risk and the most vulnerable segments of the population. These are the frontline health workers, those aged 65 and above, and people with health conditions. With the arrival of more vaccines, the campaign will be expanded to include other segments of the population. Meanwhile, the government is working with other partners, such as MRC Gambia and Africa Center for Disease Control, to secure additional doses to meet the estimated national requirement. Ladies and gentlemen, I express gratitude to Red Cross and the volunteers, as well as individual Gambians who have contributed immensely in the fight against COVID. Government hails with much appreciation the efforts of the internal technical experts, committees, including our well-experienced, retired, and serving senior government health personnel who have served in various capacities, both locally and internationally. We are grateful to our partners and friends for supporting us to fight the pandemic and recover from its effect in order to focus on building a stronger nation. Fellow citizens, to recover from the pandemic and revive our economy, we have to work together as a nation at community and national level. Together, we should take leadership and responsibility for building a healthy and strong nation. Knowing that the coronavirus knows no boundary, let us not relent. Despite the availability of vaccines, new variants of the virus continue to emerge, and ensure that we wear a mask properly in public, wash our hands regularly, avoid handshaking, and practice social distancing. Ladies and gentlemen, by taking an inoculation shot, I graciously and proudly declare the national COVID-19 vaccination campaign for the Gambia launched. I thank you for your attention.
Thank you very much, Your Excellency. for that powerful message. And I'm sure the message is encouraging, and we also encourage many people in this country to be vaccinated. Thank you very much. I now invite Her Excellency, the Vice President, to lead a team to the vaccination site where His Excellency will receive his vaccine. And then she'll be followed by cabinet members. They'll just escort the president, and once you receive him there, you are there to receive him there, and then from there, then he will take his shot, and then. So it will also be followed by diplomats, ambassadors, a UN family, the CMD of the hospital, and Director of Health Service. So the High Excellency, the Vice President will move, and then cabinet ministers will follow, followed by diplomats and the ambassadors and diplomats, and the UN family will follow. And then they will just, you will be there and you receive the president there, and then later he will be there, you will receive him. I hope you are not scared. Religious leaders can also follow. Yes, they can also follow, yes, and they can follow. Just, they receive the president there. After you need to come back again, you have your food packs are here. Your food packs are all here. PS Health, you can also follow, and Sam. Dr. Sam, you can follow. PS Jete, this also you follow, and then people follow you. Then if you are set there, you let us know, and then so His Excellency can meet you there. From that, they will also take their shot. Now, after the president, Michel boy nangay nasale ni boy hein
the single biggest donor in this country locally ma talk fii willing to support your vaccination campaign ba tey dara boy suma la boy
boy dang fo boy mu
fo leen wulal
no balama boy dama small town boy dama bëgg gis small
May I disturb you a bit? I forgot to bring my glasses. Can you assist me in filling my
let me tell you something. And I'm very used to components.
Yeah, you see.
That's quite my.
You see.
Aisha.
One.